Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for May the 13th. We're joined today by myself, Doug McGowen, as usual, and we have Dr. Bruce Randolph, Local Health Officer, and Dr. John McCullers from Le Bonheur and UT with us. So we'll be happy to take a lot of questions I'm sure that you will have later in the half hour. Starting with the numbers, 97,095 cases have been reported of COVID disease in Shelby County in the pandemic so far. That includes 143 new cases that were reported yesterday. We've had 1,635 deaths in Shelby County, so that's an increase of 3 new deaths in the last 24 hours reported to us. In surrounding counties, in Fayette County, Tennessee, 5,101 cases have been reported. In DeSoto County in Mississippi, 21,626 cases have been reported so far. Crittenden County in Arkansas, 5,689 cases. And that 7,387 cases from Tipton County in Tennessee. Now, looking at the numbers yesterday, we did some further analysis. And one of the things that we did see in the last 14 days, 23% of the cases that have been diagnosed in Shelby County have been pediatric cases. So cases in people less than 18 years of age represent more than 1 in 5 of the COVID infections that we've seen in Shelby County in the last 14 days. We've also seen that 70.7% or almost 71% of the cases have been less than 45 years old. 77.7% have occurred in Black residents of Shelby County. And the age group with the highest case rate per 100,000 population are people living in Shelby County between 18 and 24 years of age. Our reproductive rate of the virus is about 0.96 today, and our positivity rate on testing is 6.7%. So as far as vaccine data, in the Tennessee Immunization Information System, we had 328,495 people documented in Tennis yesterday. That represented 86,562 people who are partway through a 2-dose series, and 241,933 people who are fully vaccinated with 2 doses of a 2-shot series or 1 dose, 1 shot of Johnson & Johnson. That brings us to 46.9%, almost 47% of our campaign goal, and 35% of the people in Shelby County have been vaccinated. With that, I'll turn it over to Doug McGowan.
Thanks, David. A couple of updates today. First, I'll talk about the mask ordinance that the City of Memphis has, and then I'll get into vaccine updates as well. So, as you all know, there are several recent actions taken by Governor Lee and by the health officer talking about masks. Governor Lee essentially declared that the statewide public health emergency was lifted, and in our health directive that will come into effect this Saturday the 15th, the mask mandate will be lifted. And so, effective that date on Saturday the 15th, the City of Memphis will not be enforcing its mask ordinance that was passed in conjunction with the health order some number of months ago. But importantly, it's not just those two factors. It's really about the fact that 35% of people have received a vaccine, and an equal number have some level of immunity through disease. So we're really at the point where we only have about 30% of the community that is still very susceptible to the disease, and that's a real reason why we're able to lift many of these restrictions. So, but with that lifting of the enforcement of the ordinance, the City of Memphis will continue in our public facilities to follow the CDC guidelines that recommends that people, when they're indoors, continue to wear masks, especially when they're around people who have not been vaccinated. And so, just like private businesses will still be able to require masks at indoor venues, should they choose to do so, our public facilities will still require masks at indoor settings. So, to give some examples, masks will be recommended at our outdoor venues like our parks, in our zoo, and at the Botanic Garden. But at the indoor portion of those venues, in City of Memphis facilities specifically, masks will be required. Again, private businesses, churches, other organizations can require their patrons to wear masks if they believe it is prudent for them to do so. Our message is we believe it's still prudent for everyone to wear a mask when you're out in public until we get more people vaccinated and we are truly through the pandemic. I'll move on to vaccines now. David gave a pretty good summary, but we've now delivered more than 570,000 vaccines to people here in Shelby County and Memphis. Last, as you know, we received just a few days ago approval to start vaccinating individuals ages 12 and up. Last night we got the final nod of approval from the state of Tennessee to do so. And this morning, starting at 7 o'clock, we actually began vaccinating people as young as 12 years old. Now, that is a huge milestone. That adds about 50,000 more eligible people to the pool that could be vaccinated. Now we just need people to take advantage of it, parents to bring their children as young as 12 years old to any of our public vaccination sites or any of the 100 private facilities that are around and offering vaccines in Shelby County to get their child vaccinated. You can find any of those locations at covid19.memphistn.gov. And if someone you love is homebound, we are still offering that service as well, and you can register people for a homebound vaccination. We will come to you and provide that vaccination. And finally, as you all know, there's still time to enter the sweepstakes. We have about 15,000 people entered to win the sweepstakes. All you have to do is come and get a vaccine and you're eligible to enter, or have received a vaccine, you're eligible to enter. You could win a new car. Hopefully that's enough of an initiative to get people across the finish line and to come out. There's only 2 weeks left or so come on out and get a vaccine. We retain a significant amount of capacity. Final note I'll have is based on the demand and the uptick that we see, we'll determine how many sites we have open for public vaccinations, for how long, for what days, and for what hours. So again, come on out and take part in the vaccination process. Bring your children as young as 12 years old. We'll be happy to vaccinate them. So now I'm going to turn the floor over to Dr. Bruce Randolph, the health officer for Shelby County.
Thank you, Mr. McGowen. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County Health Department. I'd like to just spend a few moments talking and having a conversation with you about the new health directive. As you may well be aware, that health directive number 21 was issued yesterday. It will become effective on May 15th, this Saturday. And there's a couple of things, if you have not already seen it, reviewed it, read it, I encourage you to do so. Visit our website, shelby.community, to obtain a copy. I encourage all citizens to review it because there are some changes that have occurred. For one, we replaced the face mask directive number 5. We consolidated it into this health directive. And we also outline in it when a face mask or covering must not be worn, when it must be worn, and when face masks are highly recommended. The other thing is that, as Mr. McGowen alluded to, businesses, schools, employers, public authorities will have the right and authority to still require visitors, employees, and patrons and customers to wear a mask or face covering when entering and while in the facility, if they so choose, and if they have the signage posted at the entry indicating that a mask is required or recommended. Also, what we attempted to do in this health directive is to reduce the mandatory restrictions. We alluded to a month or so ago that we were headed this direction, that we were headed towards changing from required to recommended, moving from must to should. And so we did this in this health directive, though there are still some requirements, some restrictions and mandates, such as you are still required to participate and cooperate with the health department when we are investigating cases, doing contact tracing, placing people into isolation or quarantine. And this applies to individuals as well as businesses. We also, in this health directive, allowing large events and planners of large events to seek technical assistance from us, the health department, but they do not necessarily have to get our approval. And we encourage them to use the preventive measures that we've outlined and recommended under the business and services section of the health directive. I just want to remind all of us how we've gotten here, what has brought us to this point to where we can relax some of the restrictions. As you well know, over the past 15 months, we've been experiencing a great pandemic, one that we hadn't experienced in over 100 years, which required us to take some restrictive measures. Stay at home, mandatory measures. You must wear your mask and must close at a certain time, and other measures. But now we're at a point where we know more about the virus, how it's transmitted. We know how to protect ourselves from it. We know that if you get vaccinated, it would help you from getting infected. So we're at a point where we can move from requirement to recommendation. We can move from must to should. But I want you to be very clear. The pandemic still exists. The virus is still around. People will continue to get infected, and unfortunately, some will die. But there are some things that you can do, and I want to urge you. Get vaccinated. That's the one major thing that has gotten us to this point. People are getting vaccinated. Over a third of our population have received at least one dose. We must continue to progress. If we get vaccinated, we can do more. The other thing is that we should wear a mask, particularly if you're in a situation you hadn't been vaccinated, you're in a crowded place, poor ventilation, you're at risk, wear your mask. Maintain social distancing. Wash your hands. These things that have gotten us here is what we still need to continue to do, even though we are relaxing some things. So I just urge you, fellow citizens and visitors of Shelby County, let's continue. Let's not let up. Let's continue getting vaccinated. Let's continue these preventive measures so that we can even do more, so that we can get more back to how we used to do things and a sense of normalcy. Now will ask my colleague, Dr. McCullers, to come and share some words and guidance and advice to you as well.
All right, good afternoon, everyone, and I appreciate the city and county letting me come up and say a few words. I'd like to touch on three different topics very briefly today. The first is the mask mandate. For about 6 weeks, many medical experts, including me, have been urging the Shelby County, the health department, not to change the mask mandate. We've been very worried about the circulation of variants of COVID-19 that had come into the community a couple of months ago. We were concerned that these were more infectious, that they were more deadly, and we didn't want to see a situation like we're seeing now in India. So we didn't want to release any restrictions until we really understood what the impact of those variants was going to be. And what we've seen is that they've come under control in Shelby County. Our case numbers are starting to level off, maybe to come down a little bit, and we really have only one predominant variant right now. The UK B117 variant really is the dominant variant that's circulating right now, and it's the least worrisome of the variants that we track out there. So from that standpoint, we now have reached a comfort level with our ability to control the variants. Along with some of the new data from antibodies that suggests that about 70% of residents of Shelby County are now immune or partially immune to the virus, either because of vaccination or natural infection. This has led us to feel a lot more comfortable about the direction that the pandemic is going in and to be in support of changing the mask mandate, as Dr. Randolph has just gone through. The science tells us right now that if you're vaccinated, it's very safe to be outside without a mask. It's safe in many instances to be inside without a mask. I think it would be prudent if you're around people you don't know, particularly in crowded, poorly ventilated spaces, to continue to wear a mask, because the vaccine's not perfect, but it's really, really good. And I think in most cases it's now safe to be able to make that personal choice about wearing a mask. Persons who are unvaccinated right now are probably safe to be in outside spaces without a mask, as long as they're not in close contact with anyone who might not be vaccinated. But I have to stress this: it is very unsafe at present, if you're not vaccinated, to be indoors outside of your home around any other persons who might not be vaccinated, or in any areas where people might have been and the virus might be lingering. So I do think we need to strongly urge and recommend citizens continue to mask indoors, particularly if they're not vaccinated at this point. Although I think now the data suggesting 70% of Shelby County has some immunity says we can start to let people take some of those decisions for themselves if they've been vaccinated and they want to take the masks off during certain activities. The second thing I want to touch on is vaccinations. So as Dr. Randolph said, the pandemic's not over. We're still seeing a lot of cases out there. We've only got about a third of Shelby County vaccinated. We have to get those numbers up. The data that Dr. Sweat gave us earlier is very concerning to me, with 77% of new cases now being in African Americans. These are predominantly clustered in North and South Memphis, and those are the areas where we haven't had the greatest vaccine penetration. So particularly with loosening up of the mask regulations now, we need to be in those neighborhoods. We need to be championing vaccination. We need to be in the communities, going door to door. We have to get those vaccination rates up if we want to end the pandemic, and in particularly if we want to protect some of our most vulnerable citizens who are now experiencing the impact of this pandemic in a way that we maybe didn't see in the summer or in the winter wave. So I think it's very important that we continue the vaccination efforts and, in fact, step them up in certain areas where we haven't had a lot of success yet. The third thing I want to touch on is children 12 to 15, and I'm very pleased to see that the FDA has declared the Pfizer vaccine safe and effective in children 12 to 15. I have boys who are 13 and 15. They will be getting the vaccine this afternoon at the Pipkin site. I'm delighted to say that. I urge every parent to get your kid vaccinated as well as soon as you possibly can. And there's 3 reasons for this from my standpoint. The first is, well, as we all know, COVID's not as serious in kids as it is in adults, but that doesn't mean there's no disease. We have seen plenty of kids in the intensive care units at Le Bonheur this past year. We know kids do get sick from this in a couple of different ways. It's very infrequent, but now with the increasing numbers we're seeing in kids, we're going to see an increase in the kids that are sick or critically sick. Influenza, for which we have an effective vaccine and recommend universal vaccination, particularly in children, kills about 75 children every year in an average year. COVID has killed 306 children in the United States in the last year. So that's 4 times as many as we see with influenza in a normal year, and we strongly recommend influenza vaccination every year for kids. We, of course, want to vaccinate kids against COVID for the same reason. That's 306 preventable deaths in the next year if we get kids vaccinated. And the third reason may appeal a little bit more to the kids. You realize now, still, if you're exposed to somebody with COVID, you have to go into quarantine for 14 days. And if you don't want your school year disrupted, if you're playing a sport, if you're cheerleading, and you don't want to have to take 14 days off from the football field, get your vaccine. Take care of it. Don't worry about it. If you're vaccinated and exposed, you don't have to quarantine. You're going to be able to stay in school. You're going to be able to stay doing those things that you want to do this year. So I think for very selfish reasons, kids ought to be asking for the vaccine, saying, I'm tired of this. I want to get it over, make sure my next school year goes well. Thank you.
We'll open it up to any questions that folks have.
Mandy Rock, Fox 13.
Hey, good afternoon. I'm wondering if you have any numbers on how many 12 to 15-year-olds have been vaccinated so far, or how many shots have been allocated for that age group.
We haven't allocated any specific number of shots for that age group. It's just the capacity that we have every day at our sites is we have plenty of capacity. So at the Pipkin site, we still retain the ability to do 3,000 vaccines a day. I don't know the numbers that presented, but as of about 9 o'clock this morning, we had a handful of parents and their children show up, at least at the Pipkin site that I know of.
Okay, thank you. And my second question is about the new directive regarding the lifting of the mask mandate. When it comes to businesses, does this mean that employees also won't have to wear the masks as well, unless their employer enforces it?
Yeah, so if the employer requires that the employees wear a mask, they must wear a mask. In the health directive, it specifically says in some businesses where there is a high risk of exposure, then masks should be worn. And actually, employers have an obligation to protect their employees under OSHA guidance and law. And so in those situations where there's routine, common, close contact, there's a high probability of you being exposed to someone who's unvaccinated or possibly infected, then they should wear a mask.
Jane Roberts, Daily Memphian.
Hi, Dr. Randolph. Does your last statement include restaurant workers? And then I have a follow-up.
It would include restaurant workers if the employer deemed that they are at risk and requires it. If the employee feels that they are at risk. So even if the employer doesn't require or say that you don't have to wear a face mask, if the employee wants to wear one and feel more protected in wearing one, they have the right to do so. And so in those like hairdress salon, where there's obviously in the nature of what you do, you're in close proximity to someone, you should wear a mask.
And Dr. Randolph, I'm afraid this is maybe esoteric, but is there a situation in which the city could bring back its mask mandate and it would apply only to the city and not the county as a whole?
Yeah, public officials have the right to require, so the city could potentially, as Mr. McGowen indicated, that in the city buildings and facilities, they may require masks that you wear while indoors. They have that authority. So it is possible that cities may require that visitors, employees, customers wear masks while in their particular facilities.
Hannah Grabenstein, MLK 50.
Hi, good afternoon. Not to press this point too much, but I'm now a little more confused than I was earlier.
on page 4 of the new directive, it says masks must be worn in Shelby County in the following circumstances, and then, public transportation, a couple of businesses, and then it specifically says you work in an indoor business where you come into close contact with members of the public. So does that include restaurants? Are restaurant workers
They must wear because,
mandated?
well, yeah, then they must wear masks because under OSHA, an employer has a responsibility and a requirement to protect their employees from recognized hazards. And we know that COVID-19 is still a recognized hazard that an employee could be exposed to. And so therefore, in those situations, yes, a mask must be worn. Okay,
so restaurants are for sure, restaurant employees are mandated wearing masks right now. I wanted to ask about the thought on that because, my understanding with masks is that they provide some level of individual protection, but they're primarily a community protection measure. And I guess can you explain why, would it afford enough protection to a restaurant employee if the members of the public are walking around unmasked?
No, it would provide some. The masks have shown to protect the wearer as well as protect those who may be exposed to the person who is wearing the mask who happens to be infected and not know it. So there's a benefit to the employee to wear the mask if they're required to do so. Now, understand that's if there's close contact where there's a high probability of the individual being exposed to the virus by nature of the type of employees, visitors, workers that they may come in contact with.
Catherine Burgess, Commercial Appeal.
Hi, I'm a little bit confused about this. 70% residents of Shelby County have some sort of immunity or partial immunity figure. I understand that 35% have received some vaccine, but regarding the equal number that have received some immunity through disease, I'm confused as to where that's coming from, since fewer than 100,000 people have had COVID-19 in Shelby County. So I'm wondering if you can walk me through where we're getting this data point from.
Okay, I'm gonna have Mr. Sweat come and talk about that.
Hi, so thanks for the question. So a couple of things. We've diagnosed, 97,000 cases, but from antibody studies that have been done where we check the blood of people who have had blood draws and check it for COVID antibodies, what we can see is that basically what the data shows is for every case we diagnose, there's about 1.5 other people who have also had the disease, they just never got diagnosed, and therefore they weren't reported. So if you take the 97,000 diagnosed cases, multiply that times 2.5, you'll get the number of cases that have probably actually occurred in our community. It gets you about a third. And then for those same antibody studies, we can see the level and type, this is important, the type of immune response that's been encoded. And so we can see the evidence of vaccine-induced immunity for people who have been vaccinated. We can also see disease-induced immunity from people who've had infection. And so when we look at those blood draw data on random samples of adults, this is important, it's adults in Shelby County, we see that 2/3 of people have either been vaccinated or they've had the disease. And only about 1/3 remain at risk for infection and have no antibodies whatsoever. But that number of people is only about the adults. So what we've looked at in terms of children is about 15% of our kids have had COVID, meaning about 85% of our kids are at risk. And when you actually do the numbers, you see that there's an equal number of children at risk to the number of adults at risk remaining in our community. So but in the adults, 1/3 are completely susceptible, and 2/3 have either been vaccinated or they've had infection. So that's where the numbers come from. It comes from antibody studies done at AEL and at the University of Memphis.
Is there a
Thank
follow-up?
you. No follow-up, thank you.
We are out of time. Are there any closing messages today?
Well, first of all, I just want to say thank you to everybody for all the people who have been vaccinated. We want to say thank you because you're the people who are keeping our case numbers down at a low enough and stable level. And that's what's making it possible for the community to begin to relax a little bit and breathe easier. We are moving in the right direction, and the numbers suggest that we are moving in the right direction. But we still have hundreds of thousands of people in the area who are susceptible to COVID, and the virus is still transmitting. And half the people now who are remaining to be susceptible are children. We haven't had much to offer them as a way of protecting them other than wearing masks and maintaining social distance. Today we got a new tool. If you're between 12 and 15 years old, or really if you're 12 years old and up, and you live in Shelby County, vaccines available to you, and we would love for you to come take it. Thank you and have a good day.
Thanks, everyone. We'll see you back here next week.